only knew the power of the dark side, it is your destiny.
Hello everyone, this is Take the Gate. It is October 14th, 2014, and I am bringing you a story on Mother Jones, and this is another Ebola story. Yes, I'm getting tired of reporting on Ebola stories as well, but nevertheless, people need to be prepared for this, just in case. And this one is titled, How Long Does the Ebola Virus Survive in Semen? And I know people out there are probably snickering right now. But it says that research shows that the virus can be found in survivors' semen for weeks or months after recovery. And this is by Alex Park. Survivors face stigma and fear. Community members who worry they might spread disease even after leaving the hospital. Fear is almost entirely misplaced. Once someone has recovered, they cannot infect others through handshakes, hugs, or kisses. Their sweat isn't contagious. Even the vomit, urine, feces of the disease's survivors has been shown to be Ebola-free. There, however, are a couple of important exceptions. In particular, research into past outbreaks shows that semen of survivors may carry the virus for weeks or even months after they recover. For instance, in a 1977 study in what now is the Democratic Republic of the Congo found Ebola in the semen of one survivor 61 days after the onset of disease. A 1999 study found virus of an Ebola survivor's semen 82 days after he first became ill. So the 61 days is about 2 months. The 82 days is nearly 3 months. It says that the study recommends that survivors that become ill use condoms for at least 3 months after contracting the disease. I don't think so, because condoms break people. So that's another foolhardy recommendation right there. You're not going to use 4 condoms. Get out of here. A separate 99 study backed by the Centers for Disease Control identified one woman who tested positive for Ebola, never developed symptoms. The researchers concluded that it was unclear if she ever had contracted the virus, but it was possible that she was infected by a recovered Ebola patient via semen. In a statement issued Monday, the WHO, World Health Organization, echoed findings warning Ebola can persist in survivor semen for up to at least a known 90 days. The sample sizes for these studies are extremely small and unclear how great of a risk that this poses in the weeks following illness for men. Officials at the CDC, Center for Disease Control, was recommending that they used condoms. Again, Doctors Without Borders has been on the front lines of the current outbreak since the early stages, is distributing condoms to survivors, according to a spokesperson for the group. It says that the Ebola outbreak as recently as 2013 said that the sexual transmission could make the disease harder to contain. He criticized the public health officials for not doing enough to encourage the use of condoms. Semen may not be the only fluid through which a patient recovering from Ebola could pass on the disease. In 2000, researchers tested the fluids of female Ebola survivors whose blood was already clear of the virus 15 days after falling ill. Ebola was found in the woman's breast milk. Her child eventually died of Ebola. Though researchers could not be certain that the child got sick from feeding. At any rate, researchers, it seems prudent to advise breastfeeding mothers who survive Ebola to avoid it for weeks after recovery. So you'll have to replace breast milk if you're a feeding mother or pregnant mother that gets Ebola. I assume if you are a pregnant mother that gets Ebola, your child is most likely going to become immune, but I'm not 100% sure on that. You would have to ask your gynecological doctor on that issue, or your pediatrician or your obstetrician. Secondly, if the Ebola does survive in the semen for up to 90 days, that does not discount the fact that an asymptomatic carrier, such as a dog, a monkey, a pig, or a bat, would not carry the virus in its semen and pass it along to other groups. So if a dog has intercourse with another dog, that dog would then get sick and be asymptomatic and possibly carry on that disease for a period of time after being infected with it asymptomatically. That's just a guess, but it's not a 100% accurate guess. So I will leave a link to this in the description. This is Take the Gate. Please comment, rate, and subscribe. Thank you for watching. Signing out.